We are Tom and Karen Shoemaker. We live out in the country. Our mailing address is actually Cul-de-sac, and we live on a little creek called Mission Creek, Idaho. I'm a self-employed farmer. My wife is go ahead, you can help me out here.
A housewife. I work for the church also as a bookkeeper.
We're dryland wheat farmers. Soft white wheat is our main crop. We have barley. We raise some varieties of peas. We have a few cattle. We used to run a few hogs.
56 annoying sheep.
Yes, we have 56 annoying sheep. So that was my son's project, and he's actually smarter than I am because I'm now working for him. We have 7 children, 3 girls and 4 boys.
And 1 left. 1 in college, 1 left at home.
I have been here on this farm here all my life, and I'll tell you why I'm here. This is my grandfather's farm, and then my dad took it over, and through the days of World War II, and then he passed away in 1971, and I got out of high school in 1970, and so I'm still here. I was, because farmers and loggers in this area cannot get a group insurance. We have an individual insurance plan. And it was a good plan when it first started out, and I got that probably, it was probably right around 1971 that I had gotten this plan, because my dad didn't have a health insurance plan, and so my mom wanted me to have health insurance, and so she's the one that actually set me up on this policy. Through my own choice, decided that I couldn't. It got to the point where were we going to eat, or were we going to buy insurance? And so we chose to let the insurance go. I think it's a bad choice not having insurance. I really think it is. But we have to, some decisions have to be made, so we made that decision. Hopefully someday we can get back onto an insurance. I'm sorry for hogging the mic. It's pretty bad. Well, I felt really lost. I thought I was almost nervous to do any kind of work, because if something would happen, we would totally lose everything. But then one day I decided that we have to keep going. We have to keep doing whatever we do, and we'll just have to take the consequences as it goes on.
However, when tragedy did strike, Karen and Tom had to choose between Tom's finger and money.
And the one time Tom went to the doctor was because a cow had stepped on his hand or his finger, and it was dangling, you know. And we literally sat in the bathroom controlling the blood, saying, I can't go, you know, because this is what's going to go down the line. But we knew with the infection of manure and everything, we needed more than what could be done in the bathroom. But we did deny. The hospital wanted to make us stay overnight, and we said absolutely not. We could not afford to have a hospital stay, and against their wishes, we did come home.
The biggest regret is that one thing that did happen to our youngest son here is he just sliced the skin open on his right in his knee area in here, and that there was no life-threatening or anything like that, but it did leave a scar because it needed to be stitched together. A simple thing, nothing that 3 or 4 stitches could have fixed. But I suppose 3 or 4 stitches today would cost, I don't know, maybe anywhere from $5,000 to $8,000. I'm not exaggerating.
Because his hand cost over $5,000.
Over $5,000.
And his finger, not a hand. portion of his finger. And that was
It
no hospital.
just required a few stitches. We ended up paying, it was a little over half the cost, wasn't it? If we would have had medical insurance at that time, it would have still cost us the same amount of money because we're on the highest end of the deductible that we could possibly afford.
7,500 is what we were.
You were, say that again?
We were at 7,500. So
that 7,500 was their last policy that they had. You could not go any higher than that.
and that's when we dropped it.
That's when we had to drop it. And
We don't go to doctors.
Yeah,
We treat everything at home.
at home.
Unable to afford insurance, Karen has not been to a doctor for 13 years.
Last time I seen a doctor was 13 years ago when my son was born. My son, youngest son, has never gone to the dentist. He has good-looking teeth. He has perfect teeth, but he's never been able to go to a dentist. How does it make you feel as a parent? Rotten. Absolutely rotten that you cannot afford insurance for your kids. There's no other, way to say it.
now, we'll gladly pay into a program that would have some benefits back to us, such as some kind of maintenance program where, say, you can go get your eyes checked, or you go get your teeth checked, or you have a physical. We're not asking to be totally fixed about anything, but sometimes a little preventive medicine can save thousands and thousands of dollars. But we have to have something that we can live within our means here, is what we're after. That's not what medicine is supposed to be all about. In other words, we only doctor the rich people of the country.
We pay taxes just like everybody else. But it seemed like we were paying $500 or something. And then the next year they raised it $100. We were paying $600. And then the next year it was $700. We're going, at this rate, we cannot keep paying. I think it wasn't around the $700 mark. We finally said, that's more than our food bill. That's more than anything we're paying. We're paying more for insurance than we're doing anything else.
What does this land mean to you?
Well, I don't know. It means everything to me. It's just not a dollar value.